Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Fund application and its types. So let's begin. Firstly, it is the types of fund application. There is DOR. So DOR is DOR. And what is the degree of wrap? The degree of wrap is nothing but anterior 180 to the 200 degree of the fund application. Next is TAL. TAL is 270 anterior fund application. TAL is 270. Anterior fund application. Next is LIND. LIND is going to be 300 posterior fund application. Then comes the TOPET. So LIND is 300, TAL is 270, DOR is 180 to 200 anterior fund application. Now let's look at TOPET. TOPET is basically posterior, it is 180 to 270. It is posterior 180 to 270 fund application. And then what we have is BELC. BELC Mark IV. So BELC Mark IV. This is about 270 anterior transthoracic fund application. This is anterior transthoracic fund application. So let's recap. So here we saw DOR is anterior 180 to 800 fund application. Then comes TAL. TAL is 270. It is anterior fund application. Then comes LIND. LIND is 300. It is a posterior fund application. Next is the TOPET. TOPET is posterior. It is 180 to 270 fund application. Then comes the BELC Mark IV. It is 270. It is anterior transthoracic fund application. So LIND was 300 at posterior. TAL was 270 anterior. Next, we look at other two, that is a Nissen. Nissen is 360 fund application. And then comes Watson. Watson, if you see, it is 90. It is 90 anterior fund application. So it is 90 degree anterior fund application. So recap, it is a Nissen 360 fund application and Watson is 90 anterior fund application. To learn and grow daily like this, please do subscribe.